This is a very critical question, particularly as we're getting into this era where we have specific treatments for a specific etiology, for a specific protein accumulating in the brain. So it becomes critical to make an accurate diagnosis. Clinical diagnosis is reasonably accurate. The syndromes that we're talking about, cortical basal degeneration, frontotemporal lobar degeneration, Alzheimer's disease, progressive supranuclear palsy, amyotrophic lateral sclerosis, those kinds of syndromic diagnoses are pretty good indicators of what's going on the order of 70 to 85% accuracy. So that's terrific. That's a great starting point. But if you want to make sure that you're giving the right medication to somebody, you really need to be even more confident in the accurate diagnosis. And so there are a variety of efforts that involve biomarkers, things like imaging studies, detailed pictures of the brain, and different kinds of imaging studies, as well as studies of biofluids. We're trying to develop blood tests, and we're trying to develop specific tests looking at the cerebrospinal fluid, the fluid that bathes the brain and the spinal cord, so that we can identify specific levels of proteins or specific analytes that tell us with even greater assuredness what's causing somebody's difficulty. And as we enter this era of etiologically specific treatments, we're really going to become increasingly dependent on these kinds of more detailed studies to try to find a specific diagnosis.